So all of our programs for groups, like for an organization, again, whether it's a therapy clinic or a fire department, whatever it is, we do have kind of a sliding scale as far as the staffing numbers, because everybody's going to get a training or certification program. So we have some maybe for more entry level staff. We have some for higher level staff. So everything is kind of position specific, but the pricing is essentially customized because it's based on the level of training and the number of staff, right? So for an organization, we would say, who are your patient-facing or guest-facing or public-facing staff, right? That's who we care about. If you have somebody in the back office that does your accounting, we would love for them to be trained, but we're focused on how do you serve your clientele or the public better, right? Gotcha. So we look at everybody. It could be, clerical staff that just do kind of entry-level sort of admin work, but they're interfacing with the public or the clients. They need training too.
Hey everybody, this is Tony.
And this is Paul. We're coming at you from the Friends for Life podcast, where we discuss the ongoing lives and issues of people with developmental disabilities to spark positive change in the field.
And we have a lot of fun doing it.
All right, everybody, welcome back to the Friends for Life podcast. Thanks for tuning back in. Today we have Meredith Tekin from International Board of Credentialing and Continuing Education Standards. I cheated. I had to read it off the paper. Meredith, welcome. Welcome to the podcast. How are you doing this morning?
I'm doing great. Thanks for having me.
Awesome. So, first things first, with IBCCES, how did you get your start in working here? Because there's so many different options for people to work in this field, specifically disabilities field in general, developmental disabilities, physical disabilities. So where did you get your start?
I happen to be located where our primary office is located. So I was kind of referred to the organization through a colleague, but I've worked in nonprofit settings before. I've worked in healthcare settings before. I have kind of a voracious curiosity and also a desire to work for an organization that does good. So obviously that drew me to the nonprofit space, but it was really appealing to me to work for an organization that was trying to affect change in this area specifically. I don't necessarily have a personal connection to autism specifically, but I myself have some sensory sensitivities, and I just love the idea of educating folks and helping them be better at their job so that the quality of life for people can be improved. And so really what was just appealing to me was the combination of a growing or emerging kind of field, right? Like in healthcare specifically, we're always learning, diagnosis information is being updated, best practices are updated. So I liked that from my previous experience, and then working for an organization that's doing something helpful. So I that's why I was drawn to the organization. And then, like I said, I had a colleague that introduced me to our board chairman, and the rest is history. We've been around for about 20 years, but I've been with IBCCES for a little over 5 years.
Nice.
How exactly was the organization ever created?
So it was founded initially to provide autism-specific training and certification to therapists, so specifically occupational and speech therapists. So although those professionals obviously work with a lot of times a very, a population or a clientele that is autistic. 20 years ago, especially, they weren't necessarily receiving specialized training specifically in autism. So the company was founded as a way to provide additional training and information to those professionals online. So we are a primarily online training and certification organization. And again, especially 20 years ago, the idea was, how do we make this program accessible for these professionals that are working during the day, that might be doing this as a supplementary program? And how do we make it easy for them to kind of do it in their spare time so that they can get this knowledge and kind of get this credential, but it's not going to take away from their day-to-day, work that they do as professionals. And so we still do that work today. And then over the years, we've just expanded on our programming and our certifications based on the need that we've identified. So again, we were doing kind of online learning, before it was cool in some ways.
I was just about to say, with the time frame, I'm thinking 2002 with 20 years, that's pretty much still right outside of the .com bubble popping. And like Paul and I were just speaking about this to someone else who was on the podcast, and we were talking to how our field is so behind when it comes to being in the tech world and, providing services from afar and to many people. What kind of challenges do you have to go through? Because we're going through it now, 20 years later, even doing what we do. Not everybody wants to subscribe.
Yeah. I mean, it's definitely something that we have to constantly manage, right? So because we're creating and working with experts for the content, for the training itself. And then also as a credentialing organization, there's obviously standards and requirements that we have to meet. So, we always have to be improving and updating our content and our programs and kind of our system, the way that we manage and deliver that information. Things have obviously changed a lot in the last 20 years, but so we've grown and updated our programs, of course, but also just kind of the infrastructure and how we deliver the programs. So that's an investment that we made as an organization that, fits our mission, but it's something that constantly has to be retooled and looked at and managed, because not only does it need to be a pretty good, learner experience, but with the organizations that we work with, there's like management and tracking and dashboards. And, it's not even just the basic customer support needs of a technology. It's also trying to make it easy for these large organizations to go through programs and manage it and update it and know where they stand. So we do provide a lot of support, human beings, support to our partners, as well as this kind of technology platform to make it work for them. Because at the end of the day, change is not easy. So we're trying to open people's minds and get them to kind of meet either a higher standard or learn about something maybe they don't have a lot of experience in. Some of our partners are healthcare providers, and so they're experts in their field or their specialty, but they may or may not have an expertise or understanding of autism or other neurodiversities. And then on the flip side, we also work with organizations that they might have heard of autism, but they don't really even know what that means. And so any barrier in the pathway of ease of use or learning or implementation is obviously not going to be beneficial, because at the end of the day, we want them to have a good experience so that they continue on this journey. So there's a lot of, I would say, human capital that we invest with our programs, as well as the technology piece.
Well, I was going to ask, I mean, your website says you have a pretty big impact. I mean, you trained 170,000 people this year so far, or something like that. That's a lot. That's a lot of people being trained. So if someone wants to take, a training course through you, or an organization wants to bring you in to do some trainings, what does that process look like for them? How can they get involved? Is there a reach out spot? And then from there, like what does the training look like? I'm assuming there's multiple types of trainings you do, but what's the process look like?
So we do get a lot of individual professionals. So we have, again, different levels of training and professional certification. On the individual side, we have some individual programs where you might be an educator or a therapist or some professional that just wants to get the learning and then also have this kind of specialized credential, to supplement what you already do. So those folks can just go to our website. They can click around. We try to make it easy to find sort of what your program should be, like what's your industry, what's your job, and then there should be a certification for you. And they can essentially sign up online. So they can register for the program, take the training. We do have some professional requirements. So for some of our higher level programs, you have to show proof that you have a bachelor's degree or whatever the requirements are. And then that is an individual credential that they hold as long as they, take the training, pass the exam, meet all the professional requirements. We review every application and then it gets approved. And then they have to renew every 2 years. So if they're not doing ongoing professional learning specific to the certification they hold, then obviously we don't allow renewal. We provide a lot of the training upon renewal if they need it, but they might have gotten CEUs elsewhere. So that's something that they can just go on the website and do themselves if they just want a professional credential for themselves. Primarily, that would be, like I said, we do work with a lot of SLPs and OTs, educators, folks that are in that space that kind of want to know more. On the organizational side, they need to contact us directly. So we have lots of opportunities for folks to send us in a form or to reach out to us. And then we would work with them to basically create sort of what is it you need, right? Okay, you're a hospital, emergency room department. Okay, what's your staffing look like? Okay, here's the levels of training and certification we offer. And we kind of put everything together kind of custom for them. But either way, whether you're an individual or a group, essentially you're still going through our learning management system and you're being delivered training specific to whatever your role or your program is. We always include the viewpoints of autistic individuals themselves. So you'll see them in the training delivering some of the content. And also we work in collaboration with them. Of course, we have a couple of board members that are autistic self-advocates and professionals in their own right. But we do also put together content from other subject matter experts, right? So neurologists or special education experts or therapists. And the idea is that even if you're, let's say, an occupational therapist, you can learn from others in different fields. So it's a kind of a multidisciplinary approach, again, focused on understanding, how to better work with individuals that might be neurodivergent or be autistic, hearing from autistic folks or neurodivergent folks themselves, as well as other experts. And it's meant to be kind of this well-rounded approach with information that even as a healthcare provider, maybe you haven't heard before, right? Mm-hmm. So we really believe in kind of having a well-rounded program that has different viewpoints so that you're not just getting the same information you would get if you went to like an industry-specific conference, for example, right? Like it has to be relevant to your role, but we still want that information to come from different sources. So so everybody, whether you're an individual or a group, each person goes through that training program. They pass an exam. Again, if it's a higher level certification, they have to meet certain requirements. And then everybody, whether you're an individual or a group, again, has that renewal requirement. So you have to do ongoing learning, whether that's provided by us or somebody else, in order to renew typically every 2 years. So if you don't renew, then that's fine, but then you're no longer going to be certified, right? Just like any other kind of professional program.
All right. Yeah. That was a great explanation.
Yes, perfect.
So I see you do some stuff with public safety, and I think that's really good. How many times in the news do you hear something about like officer, takes down somebody with a disability and they're not aware? So I don't know how. I don't know how involved you are with the specific programs, but that one sounds very interesting. Because like it's a pretty common thing you hear about, and then there's like all this uproar. So what kind of like trainings are you providing to officers, first responders, people in that general field?
And just really fast, because this always takes me back, the thought of that, to the situation where a gentleman had an autistic gentleman with him, and he was trying to protect him, and he's laying down, sprawled out, and he was shot. Even though he's asking and begging, don't shoot. And he's trying to protect this young man from, getting shot and killed himself. So, yes, what Paul was saying. But I wanted that to be the first thought to people. Like, that's how drastic it can get.
Yeah.
Yes. Yeah. Unfortunately, we do hear a lot of, it should never happen, obviously. And these situations, obviously, with law enforcement in particular, but also first responders, whether that's, EMTs or, fire and rescue, these are tense situations, or they might be coming into the situation with not a lot of information. So what we focus on in our programs, we have one specifically for law enforcement, so police typically, or maybe some kind of security staff, and then we have one program for first responders, meaning fire and medical, EMTs or firefighters. So those programs are similar, but some of the scenario-based information is specific to what they might encounter, right? So what we're trying to do is educate on, first and foremost, like the prevalence of autism and sensory needs. Like, what does it mean? Some of these behaviors where you might encounter somebody out in the community that doesn't respond to your instructions, or maybe is stimming, like physically they're doing some movements that maybe you as the police officer are not familiar with, or whatever the case may be. Instead of jumping in with a notion that this person has some kind of other issue, taking a few seconds to remember your training to say, oh, okay, they might be autistic or they might have a disability. Let me approach this in a different way. So again, safety is first and foremost, but in the training, we're talking about, again, what are some of those common signs or behaviors? What are some sensitivities? What are some things to expect? How do you communicate with those individuals to get what you need from them, whether that's what are you doing? How can I help you stop doing that? Or again, on kind of a first responder side, it could be a car accident and you're trying to help the person. But if you don't take a few seconds to assess, then you could actually make it worse, right? They might run away from you. They might not want you to grab them, to help them, because, they're not sure what's going on. And then we do also see, unfortunately, a lot of individuals that are autistic or have other disabilities. But autism in particular, you might hear also about individuals drowning or what's called commonly eloping or wandering away. And so when you're searching for an individual, it might not be that individual is doing anything wrong, but maybe the family can't find them or something like that. So what are some of those things you need to be aware of? How do you approach that person, or, how to search and find that person basically as fast as possible. And then once you find them, how do you approach them so that you don't, again, scare them or upset them or escalate the situation? So it really focuses on recognizing that some of these things that might trigger an officer to respond in an escalatory manner, maybe it doesn't need that, and maybe here's some tools to use otherwise. So it's very well received. Generally, the departments we work with, it's very helpful to them. It's a lot more in depth than kind of the other crisis intervention programming that they're going through, because they're trying to understand mental health. And, there is a lot of pressure on these folks, because they have an important job. So we want to give them the tools so that they can at least approach a situation in a way that's not going to have, obviously, hopefully, a negative outcome for anybody, but particularly not a violent outcome. And most departments, that's what they want, right? The officers want to do the right thing, but they need the knowledge. They need to know, because in a lot of cases, they don't know what they don't know. And then they're misidentifying signs, or they just didn't know the best way to communicate. So it's well received. And again, on the first responder side, even if you're trying to help that person, giving them a physical exam or figuring out maybe if they have an injury or something, that can be upsetting. That can be triggering. That, you might not get the same responses from somebody who's autistic that you would otherwise if you're not prepared for that. Or how do you help, figure out if there's something physically wrong with them, if they're injured, but do it in an effective way. So that's what those programs cover. And then again, same thing for the departments that we certify. They have to go through the training every 2 years, which we update the content, obviously, with best practices so that it's new information and they're staying up to date with that.
And I was going to ask that as well. How often do you keep track of that? And how is data collected in order to really see if the training is working and that the approaches are, successful?
So as far as the data, we obviously have everybody go through our learning management system. So we track, we know everybody's completion dates, exam scores, we track all of that. And so we know when they're coming up for renewal, if they've expired, we have a whole system for that. But as far as sort of how they're implementing those strategies, it is obviously up to our partners, those hospitals or first responders or anybody that we work with, to obviously take what they've learned and apply it. But for the partners that we certify as organizations, if they've gone through our program and we've certified them as an organization, we have a whole team that just basically keeps in touch with them. We schedule periodic check-ins. We send them, tip sheets and fact sheets and kind of tools and resources that they can share with their team. Anything that they need, as far as we make it very clear, we're here for the long term to support you. So we have partners that, they get certified, they go through the training, and then 8 months later, they're like, hey, we had this question that we weren't sure how to answer. We had this interaction with somebody that maybe could have gone better, but what could we do? Hey, we want to plan this new event or partner with this community partner. What do you think? We really are on call for them as a support system for the lifetime of the credential. So we also do ongoing support, check-ins, learning opportunities, provide resources. So we're here, a phone call or an email away. So we do know that obviously those organizations that are not only reaching out to us for additional support, but also we're doing check-ins with them, right? So if they add new staff, we provide more training for the new staff. If they have questions, everything is very customized to what they need, so that at the time of renewal, it's not like we've never spoken to them in that 2-year period. We've built a relationship with them. And the idea is that this is a long-term partnership, something that they're investing in ongoing, not just a one-time training that they're doing, right? It's a certification. It's a partnership. So we do work with them in that way as well to ensure that they have kind of a support system, right? Because training alone isn't going to do it.
Right. Now, do you have comprehensive costs? Let's say, like, if my agency, for example, if we only have one person that we serve with autism, everyone else has an intellectual delay of some other, just a random example, would that, like, how does the pricing work with that per, I guess, individual or, size of company versus... I guess, like, if I was a complete fresh green to this, like, whoa, I see IBCCES and elemental P. How do I do this? What do I do? Like, financially.
So all of our programs, right, yeah. So all of our programs for groups, like for an organization, again, whether it's a therapy clinic or a fire department, whatever it is. We do have kind of a sliding scale as far as the staffing numbers because everybody's going to get a training or certification program. So we have some maybe for more entry level staff. We have some for higher level staff. So everything is kind of position specific, but the pricing is essentially customized because it's based on the level of training and the number of staff, right? So for an organization, we would say, who are your patient-facing or guest-facing or public-facing staff, right? That's who we care about. If you have somebody in the back office that does your accounting, we would love for them to be trained, but we're focused on how do you serve your clientele or the public better, right? Gotcha. So we look at everybody. It could be, clerical staff that just do kind of entry level sort of admin work, but they're interfacing with the public or the clients. They need training too. They are the face of your organization, just like your high level therapists are, or just like your, managers are, whatever the case may be. So it is customized. And then for some of our partners, we also do on-site reviews. So, children's hospitals, therapy clinics, emergency rooms, and some of our other partners that are in kind of the tourism space will actually go on site. And in addition to the training, we're going to go on site and kind of visit you and see, are there other process updates you could make? Are there changes to the physical space? Are there other ways you could better serve, these individuals? And we really don't ever ask, like, whether you have one, quote, patient with autism or 5,000, in most cases, what we're just looking at is who's interfacing with the public or your clientele in general, right? If you're in an emergency room, you don't know if that person coming in is autistic or not, but statistically, they're coming to you. So you need to have this training so you can approach every patient kind of inclusively with the same thought in mind, right? And then if you find out that they have a diagnosis or they have different needs, well, now you're prepared to work with that. But the first time they step through your doors, people should be ready for that because even if you don't serve specifically an autistic, clientele or population, they're part of our community, right? So you need to be aware. And there's so many folks that don't have a diagnosis even, right? So folks that are adults that are now getting diagnosed or, whatever the case may be, maybe they don't have a diagnosis because they've been on a waiting list to see a provider or they don't have the means to, pursue a diagnosis, but they know they have these needs. Regardless, you should be ready for that. And it's your job as a professional to serve everybody as best you can. So we don't really look at, okay, you serve this percentage or, this department only works with autistic individuals. We look at who's representing your organization and working with, again, the public or your clients, and everybody gets trained. So our requirement is at least 80%, but in most cases it's everybody because that's how you're going to also have a inclusive experience and a better experience end to end, right?
Mm-hmm. Great. Well, wow, that's a lot. We learned a lot today.
Yes, we did. we love education here, everybody.
we like to focus on, having individuals with disabilities tell their stories, but we also like to provide information to the community to learn more about how they can learn more. Like, that's really important to us. But I think we've gotten some really serious topics down, but I think it's time to lighten things up, Tony. What do you think?
I think so, too. And that goes with a little game show we like to call Rapid Fire. Meredith, you are going to be involved in Rapid Fire. Rapid Fire is a little part of the show that I ask you 3 questions. They are set in a what would you do scenario. the best thing for you to do is answer them as quick as possible and don't overthink it, because if you do, you're going to drive yourself crazy.
And they often don't make sense.
Yeah,
All right.
Are you ready?
I'm ready. I'm ready. I was born
First
ready.
one. Would you rather eat a pound of ants or bite an ant of yours?
Or bite an aunt of mine.
Yes, like Aunt Cindy or Aunt Cindy.
I would rather bite my aunt, because also I'm vegan, so I don't want to eat ants.
That makes sense. Okay, would you rather break dance on a national stage or sing on a YouTube video that goes viral?
Sing. I can't sing or dance, but I think being a viral sensation would be great.
Yes, me too. I'll have cool backgrounds and everything. All right. Lastly, would you rather bet your home on a roulette table or your car in a poker hand?
Oh, car, because I'm okay at poker and I can replace a car much more easily if I lose.
There you go. Yes. Great answers.
Great answers. Rapid fire successful. Before we wrap up here, Meredith, I would like to give you the opportunity to let people know where they can learn more about IBCCES and how they can sign up for your program, social media, all that fun stuff, so they can hopefully get in touch with you if they're looking to get certified.
Okay, great. Apologies for the acronym, but they're gonna have to learn it. So IBCCES.org is our website. That has a ton of information, blogs, all the certification information. So definitely check that out. We are on LinkedIn, Facebook, and Instagram. And for anybody that might be out there that's maybe an individual themselves that's autistic or sensory sensitive or has a family member, we do have autismtravel.com. So that's all the partners we've worked with in the tourism and travel space, recreation, hotels. So I always just recommend that for folks that are looking to take a break and have fun. We know that it can be challenging sometimes. So those partners on autismtravel.com have made a commitment and done training and certification and offer accommodations for folks. So, check that out too.
Well, we want to thank you so much for coming on our show, and hope everybody listening has learned something. We'll put all of the links that you mentioned down in our show notes on the podcast. Yes. Everybody can check those out as well. Go check out IBCCES.org if you need some training.